barriers, the taller I become, the farther you take my rights away, the faster I will run. You can deny me, you can decide to turn your face away. No matter.
It's said many times by public health officials that we have a high standard of care for Lyme disease in Canada. What we actually have, in my view, is a standard of neglect, not care. We have institutionalized a framework that does not detect the disease. When you get step one of that test and it comes back negative, the way the system currently works under the IDSA guidelines, that means Lyme disease is ruled out definitively. If you get a negative on that test, you don't have Lyme disease, you don't have it ever, you are not getting treated. That's it. The door is closed to you. And the majority of people who take that step one test do not get a positive. They get a negative. Next, I'd like to call up Shannon to speak. Lana thought she was coming, but you're coming right after that. Shannon, from the patient's perspective.
As many of you are only too well aware, anyone, anywhere in BC and Canada can get bitten by a tick. Anyone can get Lyme. But did you know that children aged 5 to 14 are at greatest risk for contracting this potentially debilitating disease? Around 25% of all reported cases are children. According to CDC research, children are bitten by ticks more frequently around the head and neck, making them more vulnerable to brain and central nervous system infections. The resulting neurological symptoms of Lyme are often misdiagnosed. So those are some stats. Our family's experience brings those stats to life. 2 of my boys have neurological Lyme disease. Neither was diagnosed here. The way the disease affected them was different, but for both of them, it radically altered their lives. My youngest went from healthy and active to a wheelchair in a 6-week time frame. Over the course of 4 months, he developed 60 of the 75 symptoms of Lyme disease. 60 out of 75. He was hospitalized at BC Children's Hospital and seen by a multitude of specialists. A perplexed rheumatologist acknowledged his disability, but couldn't suggest a cause or a treatment. But she was sure of one thing, and she told us, it's impossible to contract Lyme in BC. He was given their diagnosis du jour: idiopathic pain and idiopathic movement disorder. Idiopathic means unknown cause. He rapidly deteriorated under their care, and we continued to hit roadblocks whenever we used the Lyme word. We decided to have him seen by a Lyme literate doctor in the US. By the time we got to the US, he could not walk, crawl, feed, or clothe himself. In the US and on our dime, he was clinically diagnosed with Lyme. His blood was tested using the more accurate and sensitive Western blot test, one that had been denied to us in Canada. A positive test result confirmed his Lyme diagnosis. My eldest son had a more straightforward case. He had a weird rash, and then in short order, developed debilitating fatigue, headaches, brain fog, nausea, and muscle pain. At our request, he was tested for Lyme and other tick-borne infections. He tested positive here in BC for one of those infections. The infectious disease doctor he was referred to would not acknowledge his infection was tick-related. He was given a short course of antibiotic treatment and then sent on his way with no follow-up. At that point, he had been sick for 6 months and was no longer well enough to attend school. Once again, we were forced to seek comprehensive care and treatment in the US. Under the care of our American Lyme doctor and with the use of long-term antibiotic therapy, my youngest son is improving, and my eldest son is fully recovered and now able to pursue his dream of a military career. Unfortunately, there's a recurrent theme in both of our sons' cases. Doctors we saw were not knowledgeable enough about Lyme to make a clinical diagnosis. They were ill-informed about the testing. Even when asked specifically, we were unable to get the more sensitive Western blot testing done in Canada. As a result, our boys were not given timely diagnosis and then were denied adequate treatment for late-stage Lyme. Bottom line is that when our boys' health failed, our healthcare system failed to take care of them. We need a healthcare system that is proactive, not reactive. A healthcare system that promotes healing instead of medicating. As it stands now, the ignorance of Lyme and the systemic bias against diagnosing and treating it is condemning our citizens and our children to a lifetime of disability. I believe Elizabeth May's National Lyme Strategy Bill could change this. It needs to be passed for the sake of all Canadians. This isn't just about existing Lyme patients, it's about the prevention of future Lyme patients. This isn't just about political parties, and it isn't about medical careers. It isn't just about flawed tests and inadequate treatment guidelines either. This is about people. This is about children, families, my children, your children, being at risk of suffering and even dying from a disease that is both preventable and curable if caught early and treated adequately. This is about fighting for change in order to save people's lives. And this is why I stand here today and share our story.
Something inside so strong. I know that I can make it, though you're doing me wrong, so wrong. You thought that my pride was gone. Oh no, something inside so strong. Oh, something inside so strong. The more you refuse to hear my voice,